Hello and welcome to a new episode of Trauma Bound and the Links here. Today we're talking about caring for a caregiver who never cared for us or who showed very little care as we grow up. My name is Lucia Costin. I'm a rapid transmissional therapist, and let's dive into this because a lot of us are facing with this dilemma of what to do when our caregivers get sick. And at times they might be bedbound, it might be untreatable. Sometimes we face things like dementia, Alzheimer's, cancer. It can be a variety of things. And unfortunately, we can't predict illness. And at times it takes us by surprise. And it might find you already sorry. Maybe you are already in no contact or in very little contact with your parents, and now you're wondering what to do. Do you step into the caregiving role, or you just um, assist from the side? You continue not making any contact. How do you deal with the situation, considering the past trauma and considering the fact that maybe you're still waiting for some sort of an apology or an acknowledgement of sorts? So this hits us differently, and some of us, we are already very used with the caregiving role, especially if you were an elder child or if your role in the family at a very young age was to care and protect your siblings. This might be something that you're simply pushed into by the other family members. And at times it can feel that you're basically drawn back, you're pulled back um, into that childhood home and into that childhood trauma. It's sort of like a reenactment of it. So some people choose not to be involved. And at times, especially if you spend a lot of your adult life trying to escape and trying to go away and trying to heal um, from that feeling of being hopeless and helpless and having nowhere to go and no alternative, when you're being presented or when you're being pushed into it, it is at times re-traumatizing because it makes you feel again like you're vulnerable, like you're unable to do much. It kind of takes you back to that helpless child situation. So if you want, if you do go against social norms or cultural aspects and you decide to keep distance, that's okay, especially if being around them triggers you, makes you anxious or simply affects your mental state in any way. um, you know best your relationship with them. And at times I see people jumping at this position and doing absolutely everything in their power to please the caregivers or the parents, because they're waiting for some sort of acknowledgement, some sort of an apology. And it rarely happens. So if you're jumping into this opportunity thinking that this is your final chance, and now if you work really, really hard, they'll acknowledge you. If you show them how much you love them, they will give you some sort of an apology. They will finally see you for the wonderful person that you are, and they will finally see your light, and they will finally accept you. And you have to understand that these these people were never there for you. And why will they be there for you now? What will make them change now? If for some ever reason, whatever that reason may be, maybe they had trauma of their own, maybe that's how they were raised, we never know. But for some ever reason, they were never able to acknowledge the hurt, they were never able to see all the wounds that they have inflicted. What will make them change now, especially if they have a mental illness like dementia or Alzheimer's that really affects one? So if this is the case, make a clear um, line between what you hope will happen, what you dream is going to happen, and what the reality is. And really be aware of that and ask yourself, is this going to retrigger me? Is this worth it? How will they, why have they changed now? What makes me think that after all these years of abuse, they will suddenly change and they will suddenly be nice to me? Because what I often see is people getting worse with time, and you spending all your energy on them, and in the end you end up crying in the car all alone with no one to understand you. And you keep doing it every single day, and every day you doubt your health, your mental health, and you think, why am I doing this? Why am I even here? And it's upsetting to see it. It really brings about more stress on the individual. And oftentimes there is no family member around to help in this incredibly difficult moments, and it can cause a lot of tension and a lot of fight between the family members, and it just adds up to the situation. It adds up to the stress, to the pain, to the difficulty, um, to the estrangement, if you may. It really makes the gap bigger. You feel that nobody will understand you. You feel powerless again, and you feel you have absolutely no support. And this takes a toll on your mental health. So, my advice for someone who's looking at stepping into this role, or maybe you're forced into this role because nobody else is there, um, have the power to get out of that chaotic environment at least for an hour, or you know try to take care of yourself as well. If the ill person, if the sick person, if they're getting their medication, they're getting their food, they're well looked after, try to do the same for you. Reach out to other family members. Try to see if somebody is willing to at least financially help in, and maybe get a part-time nurse to come and take over at times, if that's the case. Not everyone has the time, but at least they can pitch in financially. It's very, very sad when you see families really falling apart and starting huge fights, um, because of this issue. And adding to that is when you're simply pushed out of this role after months or years of looking after that person. You're simply pushed out, and further blame is added on to you. So suddenly, not only you're not appreciated, but you're also blamed. So make sure that the other family members understand um, your difficulties, understand what you're going through. You should be able to have someone to talk to freely. So look into therapy, look into coaching, look into friends, anybody that is willing to really, really listen to you. Just soundboarding, because a lot of the times you might have negative thoughts. It's not always going to be pretty. It's not always going to be, roses. And a lot of negative thoughts will pop up, and that's okay. You should be able to have someone to listen and support you emotionally. You should not bottle everything up inside. You don't need to feel judgment. You don't need to feel shame. The problem at times is people don't like to hear about pain. They don't like to hear about death. They don't like to hear about illness. So the caregiver becomes really, really isolated. And this is grounds for depression, and it's grounds for substance abuse and a lot of addiction, because we're trying to soothe ourselves, we're trying to find that support, and we're trying to find that connection. We are built for connection. Um we need those friends, we need that unconditional love and support and acceptance. And it's important for you to understand that the stress of caregiving can diminish your lifetime, your lifespan. And this has been proven. So, the more you take care of yourself and the more you learn how to manage your stress, the more support you get, the better for you as a person, and the better you will be able to care for the other person who needs care. You know, we can't always have a facility to do that for us, but if that's available, then that is great. So make a clear plan of what exactly is on the field, not what you want in a ideal life, but think of it and write it down on paper. Do I have someone for emotional support? Can I have a coach? Can I have assistance? Can I have therapy? Will someone be able to fill in so I can have at least the weekends off? Be realistic. And if people are expecting you to drop everything, drop your job, leave your house, neglect your children, neglect your family so that you can be there 24/7, um, you have the choice and you have the right to simply say no. And I wish more of us would have that power inside them to go against the cultural, the what people think it's normal, and really put themselves first, not because they're selfish, not because they don't care, not because they lack love, but because they honor the fact that it's not something they can do. And they understand that it's, both sides are gonna suffer in this. None of them are gonna be um any better in the end. So again, you might be entering this for an apology, for an acknowledgement. You might think this will strengthen the relationship or build some sort of relationship, or you're finally going to be able to do all those things that were not available to you growing up. And if that's the case, really analyze it and look at it from all angles possible and see, is that really gonna happen? What are the odds of that happening right now? Because again, you know best your family, you know best your parents, you know best your caregivers. Um, Consider having a therapist if you can afford one. Um, you might want to go into the public therapy. I know there's a long waiting line for that, but again, this sort of situations, they do take a long time. So do put yourself on a waiting list. If that's the only thing available, it is better than absolutely nothing at all. And talk to your friends, talk to your spouse, see what support you have, really analyze the situation, and see if it is worth it. um, so don't don't go into this hoping for things that you know are close to impossible. Remember, you always have a choice, even if it is going against social or cultural expectations. And whatever you decide in the end, don't regret your decision. And I think this is the most important and the key aspect in all of this. Whatever you decide, whether it is to care for them 24/7, where it is to just show up in the weekends, whether it is to simply financially pay for someone to come and take care of them, or you simply decide you still want no contact at all, whatever your decision is, um, think of it that in 10 years, in 5 years, will I look back and regret it? And if the answer is no, then that's okay. That's your decision and there's no blame in it. I hope you find this helpful. Do share it with anyone you think might benefit. I'll see you guys next time.